There you go. You there, John? John? Hello?
One more time regarding the personal matter. I left you a voicemail a few days ago. You finally have it approved.
Nope. I'm looking for my car warrant.
Should have told me.
They don't know.
Ms. Norton, would you do an invocation for us?
Heavenly Father, as we gather around the table to make decisions for the county, Lord, we gather as a group who are genuinely concerned about the welfare of our citizens. Lord, we come tonight asking your guidance and your approval of the decisions we make. Lord, we just come into this with open minds and open hearts. In your Son Jesus' name I pray.
Amen.
Please rise to pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Motion to approve the agenda or make amendments.
I'll make a motion to approve the agenda without any amendment.
Second.
All in favor? Aye. Any opposed?
Mr. Chairman, just so you know, Dick Egan could not be here tonight. He had some little amount of surgery, but he had already had that, so I just want you to know.
He's fine.
Okay.
Okay, Sergeant Sawyer, Virginia Rules Camp Funding Request.
Wait, one second. Is this a different telephone number than John's accustomed to calling?
I texted him this number just now.
Oh, okay.
I called and didn't get an answer it right.
Oh, okay.
We'll get him. Go ahead, Sergeant.
All
You
right.
can
sorry,
pull,
sir.
you can pull a seat up if you want to, either way you want to do it.
All right. Let me hand these out.
Got one more. I'm sorry.
All right. I'm Sergeant Sawyer with Nottoway Sheriff's Office. I'm also the SRO Supervisor for Nottoway County. Dear board members, I'm coming to you today with an exciting opportunity to invest in the future of Nottoway's young citizens by establishing a comprehensive camp through Virginia Rules, which is through the Attorney General's Office. This initiative aims to empower elementary, middle, and high school students with a deep understanding of the laws and regulations that govern our Commonwealth, fostering civic responsibility, promoting informed decision-making, and ultimately contributing to a more engaged and just society. In today's complex world, a solid grasp of our legal framework is more crucial than ever. Young people often encounter situations where an understanding of their rights and responsibilities, as well as the consequences of their actions, can significantly impact their lives. The Virginia Rules Camp will provide an engaging and interactive learning environment where students can explore key legal topics relevant to their age groups, such as bullying, we talk about anti-bullying laws, cyberbullying laws, harassment, etc. Gangs, why gangs are dangerous, peer pressure of gangs, laws on gangs and your rights as young people. Drugs, saying no to drugs, laws about drugs, how drugs affect our lives and their loved ones, and how to make better choices. Alcohol, marijuana, and vaping. We're going to talk about the peer pressure, tools to say no, the dangers of smoking and drinking, and the laws of covering drug and alcohol use. This will not be a dry, as anybody can say that's been through law, this will not be a dry coverage of the statutes. Instead, the camp will utilize a variety of dynamic teaching methods, including interactive workshops, engaging students in discussions, debates, and case studies. We have guest speakers coming from Department of Game and Fishery, Department of Forestry, and other law enforcement agencies like Blackstone and Crew. We do team building activities, encouraging collaboration and critical thinking. This camp is a multi-day program held during the summer break, accessible to students from diverse backgrounds across Nottoway. By investing in this initiative, you'll be directly contributing to reduce juvenile delinquency. You provide a foundation of understanding that can deter risky behavior. You'll be contributing to enhanced critical thinking and problem-solving skills, equipping our students with valuable tools for navigating complex situations. We will be doing a more just and equitable society, fostering respect for the rule of law and understanding of individual rights. At no cost to the parents, Virginia Rules Camp offers these kids positive outdoor experiences, companionship, and early opportunity to make healthy choices in their lives. To bring this vital program to continued fruition, we are asking for $3,600 in funding each year to cover the cost of creating engaging and age-appropriate learning resources, venue rental, and logistics, securing suitable facilities and managing program operations, food to cover the cost of feeding all the parties involved, lifeguards for the safety and well-being while engaging in water activities. We have developed a detailed budget proposal, which is attached for your review, outlining these costs and demonstrating our commitment to fiscal responsibility. We are confident that Virginia Rules Camp represents a significant investment in the future of our children, and we believe that with your support and the support of the 3,600 that the school system has approved, we can make a lasting positive impact in the lives of our young Nottoway students in your respective districts. At this time, I'm honored to answer any questions you may have, and thank you for your time and consideration of this important initiative.
Is this an overnight camp or day camp?
Just a day camp, sir.
And it's $3,600, you said, for each year. How many years are you proposing that we make a commitment of $3,600?
I spoke with the sheriff briefly this afternoon. I think he's going to try to put it in his budget each year, which I guess you guys will see once.
So that cost can go up as
No, so we're going to stay, well, of course, food
stuff
costs.
goes up.
Well,
It'll have to
his
go up.
budget comes from here.
Right.
Yeah, so it would still come to y'all, it would just be under a line item. That's how y'all work that out.
I think the camp is, well, we had a little bit of conversation. The camp starts in June this year. And so basically there was nothing budgeted in this fiscal year for this. And you do have some funds left in your discretionary fund, and we're getting close to the end of the fiscal year anyway. So I thought that would be a solution if the board wants to support this.
And the school is already supported.
Same,
It sounds like.
The school has voted and supported it. Also, just so you know, I do apply for the Virginia Rules Grant every year. It used to be $5,000. They have dropped it this year. It is $2,500, but I have already submitted that for grant. And if we get that, then of course we will split that between.
So the state set money aside already for the Attorney General's office.
Yes, sir. They set money aside, and they lowered it this year, but I still applied for it so we can try to give some money back.
To the
we are
county
granted.
and school.
Yes, yes, sir. We'll split that, yes, sir.
Who owns the Mullins Start Camp and Retreat Center? Is that a,
Austin Star.
so it's just a place for
It's
families?
a
and-
old wooden camp.
Back up at Grayson Mountain.
Yeah, it's on that, I think it's a dead end road.
It is.
It's a really nice.
It's a nice facility, it's clean.
Sometimes you had this last year.
I did have this last year. It was a huge success.
Was it there?
It was there, yes, sir.
We've had our Farm Bureau annual appreciation dinner on that before.
It's a good facility. It has everything that most camps would offer. And Mr. Mullins, this year I've added him into the budget to give him a little something because last year he did it for free. So
I'm
What's in our discretionary fund, Mr. Bowman?
What was this?
7,000.
7,000. And so he's asked for 3,600.
We make it $1,250 back if it gets to $2,500 split it with school and county. I'm in favor of it.
it mirrors and goes in partnership. I'm on the Nottoway County Leadership Team for Extension Agents. And they did a recent survey, and all of the issues that you're gonna address were identified by the parents as issues in Nottoway County drug use, bullying, and gangs. So this is a learning activity partnering with you that would accomplish their initiatives too.
Well, it's important that the students get to see their SROs in this type of environment too, I think. Doing activities rather than just seeing them, at the school. So I'm supportive of it.
it brings us a lot closer. It did
What was
last
the
year.
turnout?
We, so because we had to wait for the grant money and there was no support, I had 2 weeks to throw this all together last year. We had 2 weeks when the grant was approved. And we had invited 80. We had to drive to the houses. It was during the summer. It was in July. And we had to hand them out to each parent. We invited 80 and 45 showed up.
Oh, that's pretty good. 2 weeks, yeah.
So 2 weeks planning,
And another thing too, Sergeant Sawyer, if you think about it, I don't know how good the networking always helps me. But they had a tragedy over in Amelia about bullying. And so if you can ever try to network with them and try to find out what mistakes they made, and we learn from the mistakes so it doesn't continue happening. So just keep that in frame. But if you guys will vote on taking that money in discretionary fund and getting it over to the sheriff's budget, is that right? Look, I'm saying that right. That would help.
So we want to make a motion, $3,600 to the sheriff.
Approve $3,600 from the treasury fund to
And I'll
the sheriff's office.
All in favor? Aye.
Okay. Thank you, boy. Thank you.
Thank you, sir. Appreciate it.
Okay, we'll get that to John. We'll get it. Okay.
Thank y'all so much.
Thank you.
All right. Mr. Chairman, next one, I get them to introduce themselves, but, you had mentioned to me what was the board members, to invite Emergency Service Solution Incorporated for presentation. What can they offer Nottoway County? So,
The main thing is trying to investigate for the citizens. We've been getting a lot of feedback from the citizens in regards to EMS. And it's hard to make decisions if you don't gather as many facts as you can. So we appreciate you coming. You guys can go ahead.
Yeah, okay. So, Mr. Chairman, board members, well, we'll hand this out in a second. This is kind of a overview, but I do appreciate the opportunity to come speak tonight. With me is Josh Mullins. Josh and I co-founded ESS 24 years ago in Powhatan County. That's where our office still is. And then Tyler Winnick is our vice president of operations over the whole company. So we were approached, like I said, 24 years ago by the county administrator at the time in Powhatan County, and they were, kind of up against the wall with needing to find some staffing options. And we told them, sure, we'll try it. We'll give you 6 months, and then you guys probably need to figure something else out. Now, obviously, we were much younger then, and just this week, we just executed an addendum to our contract in Powhatan County, adding another ambulance, a peak ambulance, to that. So our 6 months is obviously still going 24 years later. I guess for the first couple of years, the company, we stayed pretty small. We did expand to Amelia in 2003. So I'll run through the counties we staff for: Powhatan, Amelia, Middlesex since 2012. We did Cumberland for about 7 or 8 years. We're no longer there. Surrey since 2018. We staff a couple agencies in Henry County since 2020, and then Sussex since 2023. So our footprint has continually grown over the years, kind of slowly and organically as the needs have risen. And what we kind of have found is, we're an EMS agency. We're a licensed EMS agency by the state, but that license really isn't needed because we're always partnering with a municipality or a county or a volunteer organization. And our goal is to come in and figure out what the best model is for that locality. So no two counties are exactly the same, and all those I just listed. We've done everything from a per diem model to we're the fully loaded the only game in town. We've come in from ground zero and built an entire system. We have followed other EMS agencies that have tried to do staffing, and then we've gone into a hybrid now with a career fire department for the last 8 years, helping them manage the county system and the needs of the citizens. At the end of the day, Josh and I really founded ESS off the belief, David Williams is here, and back 24 years ago, Richmond Ambulance was the shining star in really the United States, and we kind of felt we could probably do this in rural Virginia just as well as they can do it in Richmond City, and I think the citizens in the rural parts of Virginia definitely deserve the best care that we can figure out. So all that being said, no one solution is right? The joke in EMS is if you've seen one system, you've seen one. All of our employees have always been W-2, fully loaded, 401k, health, vision, dental. So they're, our tenure is extremely long. Our turnover is fairly short. We have about 140, 50 folks on the books these days from across all these different markets. And we do try to find the right person for the agency. Every now and then we do have to move providers around because they're just not a great fit for the culture or the county they're in. And that's very deliberate in how we go about solving the county's needs. Powhatan, once again, I'll use them as a reference just because we've done so much. when they said, look, we think we want to start a career fire department, we went out and recruited and hired the guys that were cross-trained to go into we staffed fire, first response vehicles in a lot of fire stations, knowing that those employees would transition to county, employees once they were ready to get everything up and running. So that's been kind of our meat and potatoes. We've also had a program with the Community Service Board and the Goochland-Powhatan Community Service Board managing post-overdose response to deal with the opioid epidemic and all other drugs and alcohol. That's been going for about 5 years now, where we assign a paramedic who is dedicated to, if a problem is identified, then we come in with our partners from the CSB and try to bring services and really close that gap from identifying the problem to some kind of treatment option. And that's been really successful. We've done a lot of our head person paramedic that runs that is really active in all the community, sheriff's department, schools. They're very good at getting the services needed for not only the person that's struggling with addiction or substance use, but the families and such. The other thing I'll touch on is we had done the paperwork to be a vaccination EMS agency long before COVID, not really knowing what we're going to do with it. My thought at the time was we'll do flu shots because that's how you save lives in rural communities, is you take the flu shot to the house. So we were very well positioned when COVID hit and everyone was having the problems they were having with vaccination clinics, that we spun up one of the first in the state. And actually, I didn't even know this at the time, but we actually vaccinated Powhatan school system. They were the first school system in the entire state to get to vaccination. And we got the mass vaccination center in that county up to 250 patients an hour, or 250 people an hour. And then we expanded out and did the same thing in our partner counties, Cumberland and Sussex, or Surrey and such.
So was that at the height of the COVID?
That was at the beginning through about the middle. Once everyone else ramped up, I was happy to get out of the vaccination business.
Was that big time federally funded?
It was all federally funded, yes. Yeah. So all of our everything came through a federal grant to fund and so the county, we took an old middle school, and the emergency coordinator for the county was incredible. He came in and overnight it looked like an entirely different, he figured out the logistics on the building and the management of the volunteers to help. There's once again lines of 1,000 people, right?
250 hours, a lot of people.
And so we were the guys that were, so I, myself and the medical director put our names on the dotted line to, the stuff you saw where the federal government was monitoring. I mean, we laughed, but if anyone in Powhatan County knew that our office in the center of the county had, 10,000 doses of, vaccines sitting in the back room being monitored by the federal government. Once again, it was what was needed at the time, and that's kind of why we're a little different as far as EMS agencies go. Is we adapt fairly quickly to whatever the needs are. I put some numbers in here that you guys will be able to look at once I hand this out. As far as our rate is the rate. It's I tell people, they go, well, how much does it cost? They go, well, you can Google any RFP in any county we work in, and it's all public information. And I just put those numbers in there.
And you're just staffing. You don't have equipment.
We are just staffing. Josh and I made a handshake deal that we never own an ambulance, and we've stuck to that. So
the county is providing these ambulances?
So county and/or we do still have a couple volunteer agencies that we contract with. But yeah, so the infrastructure, and that was kind of born out of the buildings were there, the ambulances were there, there were just no people to get on them, and then managing those folks can be a challenge. And so this is the model that we kind of came up with.
Is it a minimum time for the contract? In other words, it's got to be at least 2 years, 3 years, 6 months. I'm just asking.
Yeah. So no.
Okay. So the answer is no.
We started with 6 month contracts, and we were trying to figure out if this isn't good. we want to be able to get out of this.
Right.
Now they're mostly 5, 6, 7 years. I mean, we do pretty long contracts with our existing partners to the point where when the new fire chief started in Powhatan, we all had to go try to find a contract. We hadn't seen one in like 5 years, and it's still good. It was still active, but yeah. The only other things I have is yeah, I mean, that's pretty much the 30,000 foot. We have ops managers, you know, let's say Tyler's the vice versa operation. We have what would be considered like a battalion chief in a fire department on the street, 24 hours a day, 7 days a week, in cars, you know, on the move to help manage the operations. And then we have station leads or county leads that in each county, we identify someone that's a really good fit and can work with whoever their counterpart and leadership is, whether it's the county person, the volunteer person. And that's kind of how the secret sauce is made.
Okay. You gonna pass us up?
Yeah, absolutely. I guess, and like I said, this is just a really quick, when I asked how much information you guys wanted, we're happy to add any additional context around that.
And you've left Amelia, they're going to VRS employees, I think, we're trying to.
So once again, it's a hybrid. No, we're still there
Still
in
there.
the same capacity we've always been. Like I said, the historical context is in 2017 when Powhatan went to a fully funded, fully loaded fire department. We were like, okay, well, yeah, great team. You know, it's been a good run. This week we just had an addendum to add another peak ambulance, and you know the current fire chief and the prior fire chiefs have all said, in essence, we would be, you know, it wouldn't be a good move to get rid of something that we have a resource that our colleagues across in Goochland, per se, you know, they don't have. So when we need to flex or add staffing, you know, in Amelia, we cover some events for them, and you know, we need to bring in an extra 15, 20 people. We just pull 15, 20 people in. We have done, you know, we move the times around. We do some data analytics on when the staffing needs to be added or when it needs to, you know, increase or decrease.
So when it's $788,400 a year, to staff an ambulance, 24-hour daily coverage, is that 2 people, a driver and a?
That's ALF?
Correct.
I'm going to go ahead and read this so it's on the record. So cost structure and staffing options, transport hourly rate, $90 an hour per staffed ambulance. Estimated annual cost, 24-hour daily coverage, 24 hours a day, 7 days a week, 365 days a year, approximately $788,400 per year. 12-hour daily coverage, 12 hours a day, 7 days a week, 365, approximately $394,200 a year. Pricing covers staffing, management, uniform, comprehensive training, and QA/QI processes. So that's just for the record. So when you say 12 hours, there's been discussion in some of these rural counties. We've been to about 3 different meetings. This will be our 3rd or 4th. So this entire region is struggling with volunteers on both EMS and fire. There's discussion about the volunteers are home at night and want to go run calls, go down to the station, just like they always have. But it's the folks that work away from home during the day that there comes a problem. You can't get, you know, we need at least 3 trucks running in this county all the time. We'd like them to be spread out geographically. So when you say 12 hours, that's at some of that hybrid where you're working with our agencies and saying, okay, we've got the staffing to run this for you these days. And that's an agreement that the county's involved in and possibly a nonprofit squad.
Yes, sir.
So that's a hybrid that you're talking about.
So our addendum in Powhatan County that we just sent over is a Monday through Friday, 7 a to 7 p. And that'll probably
Okay.
change at some point.
Everything has to, you know, be reset and changed and everything.
And so we have always done, you know, we started 5 A to 5 P because the volunteers needed to leave by 5 a.m. to get to work. So we would on shift at 5 a.m. and work till 5 p.m. and then they'd take it back over at night. That's now 6 to 6, and then we do 24/7, and then we do weekends. We did a power weekend shift for Amelia County for a couple of years, where we would put a second ambulance on the street just on the weekends. So it really is. I mean, one of our
It's a custom built.
well, that's one of our advantages, absolutely. Because when you hire a fully loaded VRS team, right, you're committing to that FTE, irregardless of everything else. So, we've always said, well, this is really our model is born out of the hospital staffing models, to where most people don't realize, but if you go to Chippenham Hospital, not that many people work for the hospital.
It's contract nurses.
Contract doctors, nurses, radiologists, and that's kind of, we were both at Chippenham, and that's this business model was most definitely kind of born out of our exposure to that.
What did your average pay to your employees, staff and ambulance? Just roughly.
You're up.
We normally start our paramedics at 26 or 27.
Okay. So y'all making money, but you ain't getting rich. And the reason I say that, because if you take 788, you can back up.
You already did
So
the
there's
math.
8,750 hours in a year to staff 24 hours a day, 7 days a week. You multiply that times two, it's 17,500 hours. If you divide the $788,400, we're paying $45. The county of Nottoway is paying $45 per hour to each one of your employees.
Correct.
Now, when you say 27, that's prior to the benefits?
Right. So,
So probably 33 or 4?
So right, when you add, we matched their 401k, when you add the 18, 19, 20% of workers' comp, taxes, all of that other stuff that, we have to have on them, or we do short-term disability, long-term disability, life insurance. Correct. The margins aren't, Amazon,
Right.
type margins right there. But at the end of the day, I'm a second generation. My parents are life members of Varsity Volunteer Rescue Squad. Josh, this is really born out of, we didn't want real jobs when we were kids. And so,
We both started in this when we were 15 in volunteer agencies.
Yeah.
so
But yeah, I mean, we try, like Lance, and then we have the managers on top of that. We have the guy doing HR.
It's not a job if you do what you love,
scheduling,
right?
That's right.
So all those things are calculated into that.
So y'all are very competitive in pricing. Do you do much bidding, or do y'all don't bid on anything?
we're
That's your price.
oh yeah, no, that's the price. I thought you meant, we say no more than we say yes a lot. I thought that's what you meant.
Oh, okay.
Yeah. No, and I think I shared with the county administrator, there are absolutely conversations where we just, transparent as can be, say we're not a good fit. Like
Just not gonna work out for y'all.
this is not going to be a system that we feel like we can be successful, and life is short, and all those reasons. I guess that's why you'd say our sticky factor is pretty good, because when we do find a good fit, we're a good fit.
Mhm.
And when it's not, we just respectfully say, how can we help you? We'll show you everything we can about what you possibly could do, but it's probably not with us. So.
Ms. Norton, do you have any further questions or anything you want to ask?
I think we've been researching this enough and with their
I'm very familiar with,
explanations.
what the.
Gives
Mr.
us-
Toth?
I think I've answered everything.
Thanks a lot, guys, for coming down and seeing us.
Appreciate it.
Thank you, Lance. Thank you. I'll get in touch with you after they make some kind of decision.
Thank you.
Thank y'all a lot.
Mr. Chairman, there's no use pulling out the budget yet until we get things kind of organized first. So you heard the public hearing for the fire levy and the EMS levy, courthouse construction, assessment of new construction. I would ask the board, you've had the public hearing last week, I would ask you to adopt each of these, if you would, but you have to do one at a time, I'm sure. But I think that's in your package, maybe.
All right. So we've had the public hearing. This is adopting ordinances, we're not adopting dollar figures or pennies.
No, sir.
Ordinance only.
This just allows the existence of a fire levy, EMS levy, a courthouse construction fee, and then the assessment of new construction coming on when the certificate of occupancy is issued. I'd ask for a motion on the fire levy.
Also move.
I'll second. All in favor?
Aye.
Aye.
All right, thank you, sir.
I'll ask for a motion on the EMS levy.
Also move.
And I second.
All in favor? Aye.
Aye.
Any opposed? Courthouse.
I just wanted to tell you that, Mr. Ingram did tell me off his side that he did support all four.
Yes,
I should say
yes.
it when I started off, but
And John, of course, John was very supportive in total. All right. Now we need a motion for the courthouse construction $3 fee to tax each courthouse case when those funds would be used for the
So
courthouse.
move.
I'll second.
All in favor?
Aye.
Aye. Next one is the ordinance that allows Christy Hudson to put into her book, her real estate book, any new constructions that are issued to CO. And Nick Bowles, our building inspector, will be making sure that they were compliant in regards to specs and plans. So I'll take a motion for,
I'll make a motion.
Second.
all in favor? Aye. Any opposed?
all right, very well. All right,
Just stressing again, these are ordinances put in place, it's not money.
No, that's exactly right.
It's allowing us to move forward.
we'll have a public hearing about the money soon, so, okay.
Okay, we're gonna have our second presentation, NCES.
Yeah, so you
Leadership.
guys can pull up at
You wanna
this.
come on down to the end so you can get on the camera?
Mr. Chairman, I know they had already been here before, we've had conversations. I did reach out to, David again, and he's been very gracious to have long conversations with me, and I appreciate that. I'm sure we have a long conversation with Buddy Hyde as well. But, we want a successful Nottoway County Emergency Squad, but we also want a partnership that's we feel like is fair and
Well, I can say for myself as a supervisor, I've been contacted more on this topic than anything since a year and a half.
Oh, I'm sure, yeah.
So,
And like I said, any meetings that you guys are going to with other surrounding counties, it is the topic and the primary subject all over the place. I see stuff in the news every day about different localities all across the country that are having these issues. I mean, even one to where, an organization somewhat like what Blanton's is, they're bringing in medics from Australia to staff
Well,
United States cities.
it's, during the coronavirus, during COVID, the contract nursing was something I didn't realize even existed. And those nurses were going to New York City or wherever it was worse.
Their
They would
contract is
go.
now for every aspect of healthcare, even down to nurses' aides now. But like I said, I'm not gonna sit here tonight and try to reinvent the wheel of our first meeting that we had. I just kind of wanted to hit a few topic points tonight.
Okay.
And first of all, thanking Mr. Chairman and the board for hearing us out, listening, seeing the challenges that are coming on or that the county's facing with EMS and where we've got to go. And we're committed as an organization to work with you to that goal. So with that being said, we're definitely in support of the tax levy. We feel it's something that's needed. Now, can it change from on the go forward? Sure. It's going to be probably an evolving thing after its inception. I think any locality that has started one, which there are a few, and I got a feeling we're going to be being looked at in Southside Virginia right now in the Piedmont region for this, because there's not a lot in our region that have them, but I'm sure we're being looked at and watched for this, for sure. With that being said, I've known Blanton that presented to you guys the one of the founders of VSS since he started his business. Do I think that business is a good thing? Yes, in certain circumstances, like what he said is. Like he said, you heard, and I'm glad you asked the question, what he's paying his paramedics. to start, $26 to $27 an hour. That's competitive and kind of right around where everybody is. But then at the end of the day, he is making money. He gets $788,000. Doesn't include putting gas in an ambulance. It doesn't include $20,000 a quarter to insure that ambulance. It doesn't include other operational monies that are gonna come out and be above that $788,000.
So that's gonna lead us to ask you this, we're all thinking it, and you may have answered it before. How much does it cost for you to staff an ambulance and the cost of the ambulance with the insurance, the fuel and everything?
Well, I want to thank Buddy Hyde. We've been working together for the last couple of months.
And I
And on the
appreciate that.
phone
I
a
appreciate
bunch.
that so much. You guys
Yeah.
did a lot so that
Um,
we could be informed.
and we've been giving y'all stuff. So we broke this down and we're saying.
I asked that question more for the public that's listening.
Yes, and that's one reason I say, because the public's wanting to hear some numbers, man. And that's why I'm saying per station where we're providing the fuel and the insurance,
You're providing or the localities
well,
providing?
the
fuel?
locality is provided. Well, in some cases,
I bet a lot of citizens didn't realize that.
in some cases, we got a Parker Oil gas tank and diesel tank right outside our building that we pay that bill on at our crew station.
Okay.
The town of Blackstone does, as part of what they help us out with, gives us a certain amount of
So there's a little difference
diesel
between
for,
locations.
right.
They give you a certain amount of diesel, so they have a cap on it. You don't get all you want.
We fill up our trucks during the year,
First
so
one
we
paying
get
for
what we
fuel,
want.
Chief?
They pay for their fuel.
So you pay for your fuel. It's not given to you by the locality.
So yes, Blackstone does give us a little bit of fuel, but everything else throughout the county we pay for that. Like I said, to insure these ambulances going up down the road, because we carry humans. It's not a cheap policy for sure. So that is on top of what you would be getting from that contractor that you're gonna have to pay out as well. So brass tacks of it, after looking at everything, we're looking at $750,000 per station. That would be one ambulance in crew, 750. One ambulance in Blackstone, 750,000, and presumably one ambulance in Berkeley. Ultimately, it's gonna cost them that as well, because they are a very valuable part of those three ambulances in the county right now, and the staffing.
Yeah,
that they're putting
regardless of whose name's on the side of it, it come up and it's a nonprofit, it's a 501c3.
Yep.
750.
And that's minimal. Now, can that cost go up? Sure. That has lots of variables, just like Blanton's variables, staffing and how you staff those. To staff those ambulances, each station is going to need a minimum between 8 to 9 full-time providers to cover an A, B, C, and D shift that's based off of a 24/7.
They can't run, you can't run 2 12-hour shifts
Cost you more money, more people.
because of overtime.
Well, not overtime. It just, you have to generate more people. And
It looked like to me, if you
It's
done 3 8-hour shifts, that would create more people than 2 12-hour.
yes, you're right. But see that every time you break it down, it adds personnel to that factor. Right now, 24 hours on, 72 off. That means that the 2 crew member at one location is working 7 days per month right now. That's their minimum. And then, so each time you got that A, B, C, D shift at crew, that provider's working 7 days during the month, 7 24-hour days. And then when you backfill that, you heard Blanton call FTE, full-time employee, or part-time employees, the way we generate that, and like he said, back in the Richmond days, and that's how Blanton and I met each other. My history was, I started here as a volunteer. I went to the Richmond system, progressed through that Richmond system, and I was the operations manager there for the last 3 years. I was in the Richmond system, doing about 75,000 calls a year. So with getting a certain amount of part-time employees, and you consider if you get a good active part-time employee workforce that don't cost you anything, but they're there to cover vacation time, call out, sick leave, so forth, 3 part-timers equals 1 full-time.
And
But they don't
you're
cost you
full-time, you have a couple of full-time. You have 8 or.
Oh, no, we've got, right now, I've got enough that I'm staffing all A, B, C, and D shifts full-time right now. So I've got 8 committed
This does not
911.
include Fast C.
Does not include.
You said
Fast C.
committed 911.
Yeah, they're all committed to the 911 system, and then all total, I've got 31 employees currently now.
So if
between
that's the
full-time
case,
and
I'm gonna
part-time.
ask a question, and don't take it from me trying to be arrogant, because I'm certainly not. Very respectful, I'm asking. What the citizens who asked us why we only have one staff ambulance 24 hours a day, 7 days a week, only one
Mhm.
with 31 employees. Why is that?
Because part of those are part-timers. They don't work every day.
It don't matter if they don't
Now-
work for 2 hours.
Oh, no.
If they don't work for
Well,
2 hours, if you got 31, you cover.
Hear me out and understand. 4 shifts, A, B, C, D shift.
All right, let me write that down.
All right.
A, B, C. So you're 8-hour shift.
24-hour shifts.
So,
4
so
shifts,
we
A,
gotta
B,
go
C,
deep.
D. So that's
Okay.
8 people.
Okay,
That are all full-time employees.
okay.
All right. That is one station, one ambulance
Okay.
per day.
Which is all we got, right?
Right. And that covers that 7 days.
Okay,
Because those employees, those 8 employees are working 48 hours,
okay.
right?
He keeps referring to one truck. Burkeville has another truck.
Yeah.
The citizens who keep saying there's one truck available,
Yeah,
One by Nottoway.
right, it's not,
he's got one and I've got one.
so we got 2 in the county.
Right now, yes. And sometimes more, it just depends on how that works out, because when you're doing that scheme of that 24/72, each set of employees has a short week where they're only working 24 hours. Then they pick up at least a minimum of another 12 to give you 36. Now, if you're gonna put on a second truck, you need to double that amount of employees, which is where we're gonna need to do
So
some
you're
hiring.
16,
Yeah, yes,
you're 16.
So
you'll need that. I don't have that in full time right now.
So you need to, how can you get that? Can you let some of the part-timers go and say, I need full-timers? Or how you do
Part-timers
that?
don't cost me anything. They don't cost you anything. They work, because a lot of those folks are.
They don't cost you anything? So
Other
they're
than,
free, they're volunteers 100%.
no, they cost you when they're working. What I'm saying is they're not guaranteed hours. A full-timer, you're a full-time employee, you want your 48 hours.
But I'm also gonna work
Part-timer-
you for 48 hours. You ain't
Exactly.
gonna just stand around there with a fan.
Exactly.
Right.
But my part-time staff, when Zach calls out or is working Chesterfield for Chesterfield Fire Department on his off days, and one of my full-timers calls out because they're sick, got the flu, their kid's sick, Zach isn't working, then I call Zach, my part-time employee, come on over, because he doesn't cost me overtime.
But if Zach says he can't come, then what do you do? Go to the next man?
That's, go to the next man. That's why
Is
you
your
got,
full-time
three-
employees a light of moonlight, as in, can they have a second job?
oh, they got 2 and 3 jobs. Yes,
So
sir.
they moonlight, they
Yes,
can
sir.
moonlight.
Yes.
Oh,
Can't stop that.
and
You
they
can't
don't
stop that?
No.
oh, he's trying to can stop that. You might lose employees, but you can stop
Well, and
Food Line
that-
does, Food Line don't, the truck drivers down there in Walmart, you don't do no moonlight.
well,
You gotta take into consideration, you're talking about the EMS and not food.
that's right. It's a
Food
total
store,
different
your
industry.
y'all ain't
Your
got one
full-time
employee.
employees, are they receiving 401k insurance?
401k, 3% match with the organization,
So what
insurance,
is-
50%
So
match.
similar to what
4%
ESS is,
Yes, sir.
same type of
Everything.
package.
Yes.
So really, Bo, the ESS, without the equipment, without the insurance, without the,
Any of that
Fuel.
780,000.
you're gonna be north of $1 million, 1.1, 1.2.
Per station.
Per station.
Now, I'm not saying our costs couldn't get to $1 million if you had
This is,
manpower issues, because overtime is any budget killer at any organization, whether it be healthcare or going to Food Line. Nobody wants to pay overtime. So the goal is make sure you got your staffing where you need it. With that being said, and what Blanton didn't say, because that would have been my question to him, is what are you doing with the current Southside Virginia and Piedmont, Virginia issues with current staffing right now? The shortages of those, because we're all under the gun of that. Of our current full-time employees, 10% or less are Nottoway County residents. I'm pulling guys from Emporia. I've got somebody from Buckingham. I've got people from Lunenburg. And so you're pulling your manpower because the state, and those are recorded numbers, are turning out less and less certified providers every year. The pass rate for our classes, so that's something we want to work on in the future too, is how we're looking at recruitment and retention and having successful candidates for these classes. We're looking at hosting another EMT basic class in October. I can tell you that our local paramedic class last year turned out 4 paramedics out of an entire class. 4 for the entire region. And the bad part about that is those 4 paramedics they turned out And I've got one of them, thank goodness. But they're already committed working somewhere else, because most of the time they're already working full time and going to school to get that next level certification, and they're not open in the workforce. The only way you pull them in is by being that best employer, offering the best area to be working in, the best equipment, that kind of thing.
Let's talk about what Mr. His name's Blanton.
Yeah.
Let's talk about when Mr. Blanton talked about a hybrid situation.
Basically, hybrid
You've
is
got
what
the
we
trucks,
were.
you've got the real estate,
Right.
he's got the staffing. Is that something that you would be open to?
We would be open to it, but I don't think it's financially feasible at that point, because you're gonna be paying
Well, but
that
right
much
now,
more.
yeah, but you're hiring right now. You'd have to
I've
put
already
the second truck on, you'd have to hire.
I'd have to hire some folks to get
If the
full time,
county
or
did
it's
it,
gonna cost
if
me
the county did
small
it,
time.
we'd have to.
That's right.
He's got staffing now. Our citizens, I've had 3 phone calls in the last 10 days. One was it was an ALS call, should have been, and it was BLS that showed up.
Mhm.
We had one down in Blackstone, his wife had to drive him. And then I think we had a birth in the county.
Now, those particular calls, of course, without going into HIPAA issues,
Mhm.
the one that had to get driven themselves, I'm pretty sure it's the one that they walked up, rang the doorbell.
We don't want to say names.
And we won't say names. At that particular current time of that call, we had 2 active Nottoway ambulances on the road.
So you
We
were-
had
so you
2
were working.
active,
And
we
squad,
had
the
2
squad was just
active
out.
Burkeville ambulances on the road. Multiple calls going off. That particular day, we had 24 active 911 calls in the county, and we were staffed at 2.
That was important for people to hear.
Yep, it was very.
I mean, and this is, and historically, like I said, I've been doing this for 32 years. To be able to predict the 911 monster is
Yeah.
impossible.
Well, man, the moon, sometimes the moon has.
And very much so. And I can tell you, we need 3 ambulances in this county. This past month, prime example, we had, as Nottoway County Emergency Squad, we had 158 responses last month. Our normal responses or calls that we get is a little over 200. But I can tell you where that call volume went. It went to that man in the corner up there in his agency and some
So
other mutual aid agencies.
Let's go back to
around.
the question of the service being provided to citizens.
Mhm.
If we would work with somebody like ESS on a temporary basis
Mhm.
while you were hiring and finding staff, are you willing to let them in your squad?
That would be, I leave that up to the captain, of course. He's the
Captain?
ultimate.
I'm not gonna
Person
answer
make
that
that.
right now because I have a committee I have to answer to.
Okay, that's fair enough.
And like I say, I received an application today,
Mhm.
but with that applicant, I can tell you, this is one of our biggest issues is getting all of this under control, because that applicant, when they reached out to me to put in their application, well, I don't want to do this until you get your money issues straight down there. I don't want to come to work and get laid off or fired, or there not be money to pay me. So it's
That's
definitely,
understandable too.
and it's definitely hindering me with my goals of trying to staff and or get new hires on board. You know, and Blanton's gonna be pulling from the same, that he
Well, I
can
want
pull
to-
from here and
this is for
there,
the-
yeah.
This is for the citizens also. We've passed ordinances. Those ordinances will get numbers attached to them as part of our budget process.
Mhm.
The county won't see a nickel till November, December. So that reserve that we have, that we're required to have, it's now earning, we'll be pulling money out of the bank account
Yes,
to do this. So this is,
Let me ask you this for transparency reasons. The money that you have requested, what is that money needed for?
right now,
Yes, sir.
payroll, and of course, we have bills just like everybody else. We got a $6,000 or $7,000 gas bill at Parker Oval. We've
But I
got
mean,
insurance bill.
so, all
We've
right,
got-
let me be more specific. So if I were to say that I'm in favor of the Nottoway County helping you guys out with y'all's request, but it is only to staff this second ambulance in the means of labor, is that gonna help y'all? That ain't gonna help y'all none, is it? It's gonna help the citizens of Nottoway County.
It's gonna help, but
Yeah.
like I said, you have to, as the county, remember, It is your responsibility to help provide this service, and if we're not getting enough money, like I said.
But
then
if we,
put
if
those
the
people
county,
in the
if the
truck.
county has responsibility to provide this service, then the county is gonna run the service. We're
Well,
not gonna go.
Well,
to
we've already talked about that. We're already looking at putting Buddy on our board, two of you on our board on the go
We
forward.
already discussed on that.
And
Yeah.
that's an evolving thing. We don't know where this is gonna look like in 18 months. It could be a situation where at some point.
What
the
a
county
citizen,
definitely-
what citizens
puts
are
on.
concerned about, not in 18 months, but in 6 or 8 months, that not you all individually, but y'all's agency will come back to the county and say, that $896,000 is gone. We don't have no fuel money. If y'all don't help us again, we can't operate. Well, then we
we've been
really
given
bad.
monthly, we're given monthly. We can do weekly what payroll is. So it's very transparent. You see exactly what it costs.
But I'm gonna back up and say this, and then we're gonna move forward, because I ain't got all night sitting and talk about it. Going back to the $896,000 request, if Nottoway County was to say, yes, we're gonna fund that, but it's gonna go specifically for more employees to staff another ambulance only. That's the only way you're gonna get it, and it's gonna be in the form of monthly check from the county. And it's got to go to the employees that you hire to staff that other ambulance. Is it gonna help you out of this hole you're in?
Oh, yeah, that number, yes, because that's what we need. That number is based upon running the operation, what we need to be able to do that. Because you got to remember, we're also including our projected revenue recovery of over $500,000 for
Projected revenue, I'm a little bit
Projected.
familiar with projections.
well,
I can
right
project a whole lot
now,
of things.
and I can show you.
I
I can show you what our monthly has been since January, that we get anywhere from, and it's, you heard Mr. Hyde talk about it, it's hills and valleys. Our projected, or what we're getting revenue recovery on return of service through billing is anywhere from about $40,000 to $60,000 a month.
Speaking of that $40,000 figure, citizens raised this question to me. Is it the profit from the fast C per ambulance?
That wasn't even those, no.
That doesn't, but you said in the last meeting we had that the profit from one of those ambulances covers about 1 month worth of salaries.
Yes.
In labor.
Yes,
Is that
that is
right?
correct, yes.
So if you got 2 of them, you're 2 months worth of salaries in labor.
No, the entire contract, we've got 2 ambulances out there.
So it's not
So
per ambulance.
It's not per ambulance, that's per the contract itself.
Are y'all soon
So-
to get a 3rd ambulance in June or July, or is that public rumor?
Out at Fast C,
Yes, sir.
that's still rumor, that has not been authorized yet. They're part of the contract says that when they do it, we got 30 days to comply with that. And they've got a lot of things going on.
So they
out
do
there.
have a proposed contract of doing a 3rd one to you guys.
Yes.
Well, they always
that's always
had
there.
that.
That's always there, but they
They
pulled
do that.
one of them back.
Coming forth with a new date, could be June or July.
Could be, yeah,
So
could
what are
be.
you gonna do by hiring staff for that?
One ad, Facebook, you gotta look for people. Just like anybody else, just
But
about
with that, with Fast C, if they went to free ambulances, that requirement would be all that staff has to stay out there on the ground.
Yes, ma'am, that's a,
So that
that's a
doesn't solve the
dedicated
problem
company.
that we
But
have.
yeah,
but you gotta remember,
Their money.
it helps the money situation, because that's the reason we did it in the first place. So that we won't hear 8 years ago jumping up down like we're jumping up down now. We've always needed more money. We have existed since 1955 with what little bit the county gives us.
But y'all was
But we're-
also 100% volunteer until 2002, correct?
Correct.
Right.
2002.
That made a big difference.
Yes.
Y'all could have big money in the bank. And you probably did up until then.
Hey, it's gone.
Right?
Yes.
Past them.
Yes, sir.
We used to see a lot of donations that we no longer see anymore.
But the question, I had a guy tell me, I had a crew, pretty respected fellow, say that his family made large contributions until he found out that Medicaid and Medicare was being billed. And he said he thought it was run solely on those.
And there's a lot of misconception amongst our
Yeah.
citizens and a lot of education. And that's key, I think.
So they think y'all don't need it no more.
They think we don't need it anymore. And they don't realize what it costs to run the operation based upon career providers versus all volunteer providers. So there's a big misconception and a lot, and I'm gonna tell you this, I've been polling and welcome to talk to any citizen in this county to kind of talk them through it. But there is a lot of support in this county for the tax levy because they understand that it's no longer. But there are a lot of people that just have an expectation of it being free, and
It's
was
a lot of
never
people that's
nothing
gonna
bad.
have the expectation of it to being more Johnny on the spot when they get this levy.
Well,
If they
I
pick the
can,
phone up
show
and
you,
somebody goes there and says, you don't need a ride to the hospital,
well, I can
you're
tell
probably
you,
right, but the
and I
fact
can
is,
show you
everything
numbers.
3.5 cents, they need to ride to the hospital.
and we've supplied these numbers already to you. Our response times, on scene times, when the system is not overwhelmed, like I said, when
Doing that fella going to the
when that
state, right?
particular time, because that can happen. But when the system is not overwhelmed and people have time to get to the hospital, drop that patient off, get back in the county, and that next one goes off. Our average response time is under 8 minutes to get to the scene.
8 minutes.
Yes, sir.
That's if it's in the corporate limits, right?
No, not necessarily.
You
Well,
can't
now,
drive to my
well,
house
I
in
can
8
tell
minutes
you
if you're in
now,
the plane.
I can tell you now, because of some of our stuff.
$1,000.
be-
If you
because
leave
of-
the station in Blackstone, you won't get there in 8 minutes. I
But,
promise.
and I
Ain't no
I'd
way.
love to do this. We have, and I'd love to say this. We have what we have done, and we implemented a life in the day. And I challenge all of you to come ride a day with us. Get in that ambulance, come see what we do, and experience it firsthand.
Last question. and we-
I've done it twice.
Mr. Chairman, I'm gonna- all my position- I had all family members do it. One more question, just for transparency again. A citizen told me, and I don't know whether they was on EMS before, on y'all staff or not. Do y'all provide like, when you see, you gotta eat, obviously, and I love to eat for one. Do y'all pay for the employee's food with your funds when they on duty?
No, not,
So when you see
Now-
an ambulance sitting in an establishment, y'all are not paying for it?
no,
Okay, well, that puts that to ease. I appreciate that.
Do you have somebody ask you about that?
now I can tell you out of,
You had to?
during different times of the year, and I'll tell you this is coming up, so if y'all want to help out in any way, EMS week is coming up for this month of May the 18th through the 24th. We do things during that recognition time like any other industry to recognize our employees. A little something here, there, gift bags, something like that, gift cards to go to the pizza place and get pizzas that day, or we'll provide pizzas. But it's not an everyday thing. We don't provide meals every day.
I'm glad you answered that. Okay.
All right, so as part of our investigation here, trying to figure this out, I had asked Mr. Hyde to put together some numbers. If the county was to hire VRS, paramedics, and a county employee, county benefits. Again, we don't have equipment, so you guys would have to talk to your board, or if we get on the board, talk about where these people would go to be able to run calls for the citizens. So right now, we've gotten two numbers. Mr. Williams was about $750 per 24-hour squad. ESS, just the staffing, so remember that, $788,400. That did not include fuel, trucks, anything like that.
Insurance is light.
So that one,
For the
that would
building.
cost to the citizens, you're gonna be over probably 1.1, 1.2, I would assume. Mr. Hyde, if you could just speak to if they were, I've had citizens ask me that if the county's putting that much into it, they just need to work for the county. I've had that half a dozen times. You can just speak to what you found.
In terms of just doing, I think we call it option 2.
Yeah.
So the advantages, you want to hear the advantages for
Well, just,
doing that?
we're, any advantages, but also the cost. I know we're saving lives,
Sure,
but
sure.
we're spending
Well,
tax dollars.
Well, like Mr. Williams said, I mean, the salaries are, no matter who pays for it, the salary range, it's gotta be competitive. Obviously, you can try to do it as cost effective as possible, but then you gotta survey the market to see if you're pulling the people. I mean, obviously, I was talking to a couple counties today, and people are jumping for like a dime or quarter. I mean, I think sometimes a dime is exaggerated, but they'll jump to 50 cents an hour. If it's salary, what they're looking at is benefit package. One thing that actually attracts EMS employees is your work schedule. And I heard Mr. Tove talking about schedules. And we can sit in and have a whole 1 hour conversation on schedules, but everybody in this room that knows EMS and fire, the schedules are attractive. The 24/72 is like the hottest thing out right now. And what that does, it cuts your overtime. So you attract people by how your schedules are, whether you supply a retirement plan. I think you mentioned 401k. So the one difference is if you do local government, the only difference there is VRS. Everybody knows what VRS is. VRS is obviously something you can take from job to job to job. And in terms of how much is VRS, well, it's going to depend on what your salaries are set at. I mean, it's a percentage coming off, but HR always does that. HR can figure, hey, I can do the numbers, but I need to know exactly what that total payroll is.
So what Mr. Williams has given us is that $27. And then with the benefits, you're a little bit over 30, 34, 33, something like that. ESS is kind of in the same place. So the county's going to be in the same place at that 26, 27. The only difference is they do have access to the Virginia retirement system, which is not being paid by the county. Well, we pay some of it. We pay into some of it.
Yes.
But, so the county, of course, is a nonprofit. Mr. Williams is a nonprofit. ESS is a full profit. So this man's making money. So we would expect our costs to be similar to what Mr. Williams has presented for 24/7.
Maybe going with the VRS, and I'm sure Mr. High would agree, it's going to end up running a little bit more because our current benefits package with our 401k, we do a 3% match. So it's the employee's decision on what goes in. With VRS, like you said, it's based upon what they're being paid. And I can tell you, talking about staffing issues, I did an interview last week before last, for a young lady who was looking at traveling a great distance. And the reason she was looking at coming here, and I won't say where she was at, but she was in a VRS system, and she was currently what is known as an EMTA in advance, the middle level. We have EMT basic, EMT advanced, EMT paramedic. The current location she was at did not recognize or pay her anymore for the advanced level. Okay. So we do. So I made an offer that was a better salary for her at that level, but because she was VRS, she turned me down because of the other benefits. It's something that you weigh out in each person, especially if they're driving from any kind of distance or coming from a different locality. Like we're saying, it's what's attractive about that location or that employer. And like I said, people, we don't have enough, point blank. And so to be attractive, I'd be 100% on board with option 2. And we help out as an organization as best we can or as we need it. I'm 100% on board with that. Or to start with, start to fund it now, get us up to speed, get us back to where we need to be, and realize that it can transition to option 2 as you do more investigation or as the system develops. 100% agree with that.
So if I'm laying out payroll, which a lot of us have done, you obviously got your salary, wages, your FICA, you got some unemployment, which is a little bit, I think, on fee, that the workman's comp, all that comes off. And then when you get to your benefit package, the differences are VRS would be part of a economist scale. For people that don't have it, that's not even an option, but they're not eligible for it. But for government, if you're eligible, or any agency that is eligible, you figure it in with all the other employees. So you have an economist scale savings there. At the same time, you do health insurance, you do other benefits. So those are the differences. Whereas a lot of 501c3s may elect to do the 401, they may elect to do health, they may not. I know I did it with a 501c3. It's very expensive every month because they usually do it with just a few employees, and it's pretty expensive, about $5.95 a month at least.
That's what we were saying before when we first met. Should they become a Nottoway County employee, that actually bumps you up to that next level, because then you would show over 100 employees. Y'all would get a break on the county, we get a break on their insurance, where right now we pay 50% of each employee's premium just for the employee.
So you're not doing any family benefit?
No, it's available, but there's no contribution by the organization. Can't afford it.
And then depending on the entity that's actually employing the EMS providers, it would be whatever your packages currently are. And you just see what you have to do to add them on. It's differently, whether it's dental, whether it's medical, or whatever it might be.
And as the emergency services coordinator, you've had experience in scheduling squads.
Oh, sure. Plenty of years. Payroll, billing.
So we wouldn't have to worry about management of a group.
Right, you get guidance of it all, and so forth. No problem in that. No problem. scheduling is as Mr. Williams will tell you, scheduling,
Yeah, we-
anybody that does it is,
Phone rings
is a moving target.
all hours of the
Moving
day,
target.
every
Can't
day.
come in, can't make it.
Can't make it,
Busy.
child sick, like I said, so that's why your staffing varies, and that's with any business. Any business, yeah.
You got some that's dedicated, that's gonna be there, and they won't miss a day in 10 years.
And some that
And you
probably
got
shouldn't
some
come to
that-
work that still do when they feel that bad. Yes, sir. Very much so.
Sometimes you have these weird excuses.
Of course. Ms. Norton, did you have any questions for anybody else?
No, I'm just wrapping my head around all of it because the people have been burning my phone up for that. I see they're delivering their staffing challenges, but we're running one ambulance. And that staffing challenge and deficiency is creating this problem. And then we have to call on our mutual aid partners in Burkeville and run them.
There's a ripple in the pond.
We will run too, but we gotta pay for it. I mean, there's nobody's getting in them and doing it for free. I got applications if y'all want them. That's what I'm saying. We want to put we need
But
to
you
put
don't
two
have
trucks
You
the
have-
on the road.
funds to do it.
Correct.
That's
DB,
the issue.
DB, say that again. You have plenty of applications.
We've got plenty of applications for volunteers if anybody needs.
So the
it.
funding is the key for you.
I've been a
Yes, sir.
volunteer for 63 years, so I've got plenty of applications.
I don't know, the change in the medical field and all that now. If your volunteer is skilled and certified and all that, but it's
That's
just.
part of the exact problem. Yes, ma'am. Very much so.
And it's hard to do, for a lot of people in this economy, it's hard to give up your time for free anymore, because some people are working 2 and 3 jobs just to make ends meet.
And they get paid for
And the
it, so they
training
ain't got
and the
time for it.
mandatory
Yes, sir.
training
This
for it
is
is.
the things you want to, so if this group, somebody, 2 board members and Buddy is on your board, or I say our board, whatever y'all, if y'all
Yes, sir.
redo your bylaws, these are the things you'll have to iron out at the table.
Yeah, and that's what I'm
That's
saying. We're,
Yeah,
we're looking
you
at
gotta
the
get- I gotta
immediate
get the money
need
for
right
them
now to
first.
get 2 Nottoway trucks on the road and already having our 1 Burkeville is the money needed to go forward, do that. Do I think this is gonna be a changing thing? Oh, yes, board, I do. I think it's gonna be a very much changing thing over the next, little bit.
What is the quickest way to get 2 squads on?
I need that monthly stipend to start next week. And then we might have to eat some overtime right now. For
So
me
how
to
much
get
you need,
next
how
week.
much you need a week on the schedule you gave me a while ago?
I was gonna say with the figure I heard y'all talking the other day, 80,000 a month.
So you pay $80,000 labor a month to staff another ambulance.
Yeah, and of course, that's us augmenting with
Well,
our
wait a minute
revenue
now.
recovery.
Hold on.
That won't cover it.
80,000 a month, 10 months is 800,000. That man was gonna do it at 788. And I was talking about only fuel, so I got a big discrepancy with the numbers now, Mr. Chairman.
Well, y'all had said 80 earlier, and I'm just saying,
But
you
I'm
break
saying,
down to 750.
If we go to
if you want.
80,000 a month, if you want for 10
I'm
months of
just
the year,
saying.
that's $800,000. And we're talking about only for labor. And that man's gonna give us only labor for 788, 400 for
750,
12 months.
750, 62.5.
Say again?
750 was 62.5.
750, 62.5.
That's what. he
And
said,
at
750.
the end of the day, we're
If you
still
look at
paying,
Hybrid though, hybrid is 394.
that's for 12-hour days.
I know, but it would give us.
And we can do
About
that too,
that.
if you want one 24-hour truck and one 12-hour truck.
We want a 24-hour truck. We need a 24-hour truck.
Then you.
And we can get the 24-hour truck for the 788 for 12 months. But
No, we don't have a truck.
what?
We don't have a truck.
We can lease a truck.
And that's,
14,000
and that's
a month.
only
Oh, but, hey,
one
was
truck.
Was y'all's truck lease is 14,000 per ambulance, is what we talked about, right?
Well, not all 3.
All 3 of them is on a lease agreement for 14,000 a month.
Yes.
2 or 3?
Three.
3. So but you said you didn't need them no more, right?
Well, we could, if we don't go back out to Fast C with a 3rd unit, then I think we're heavy by 1 truck at least.
Is that an extra truck maybe? I mean,
Yeah.
or do you already have an extra backup truck if one blows up?
We already have an extra.
Oh,
backup.
okay.
We have currently
So-
8.
If Fast C went back to 3 though, would you still have an extra truck or you'd have? to
We'd
do
still
it?
have an extra truck because we currently have 8 that would include those 3 out there. That would leave 5. You got 2 ambulances on the road every day. And of course, you're rotating stuff in and out depending upon what service is going on. So yes.
We're not deciding anything.
No, we just
We're
gather
still
another.
gathering more information.
But realize when he's saying 788, that is 1 truck.
But it's staffed 24 hours.
Yeah, that's what we're doing
And
now.
I asked you
We're
how much
already doing
But
that.
I asked you how much you needed a month just to staff the ambulance.
That
You
would be
said
the second.
but you said $80,000.
Well, I
And
did
that's
it
just
off
for
of a
labor.
number that I heard off of this meeting
We need to,
earlier.
we need to go back and look at that number.
Well, then take
And you can go back and
750,
figure that up. I don't think. you know
take
that.
750 divided by 12. There you go.
62.
62,000 a month. Well, we just saved 18,000.
Like I said, and I
No,
can,
more than that.
it's whatever that, I told you, 750 for the year for one truck. And
Mr. Bowen, do you have anything else? We're gonna move.
No, sir, I think,
Mr. Hyde, Mr. Toby.
No, sir.
Unless you have questions.
What's next?
More hard discussion.
Yes, sir. We appreciate y'all answering.
with a whole
Now, I'm
lot
gonna
of
tell that
agitation.
citizen to look at this because y'all not buying all that meals that they said y'all were. I was gonna come up and give me a job just to eat.
And of course, when they see those people out eating, they're trying to get some sustenance in them before the next call.
And they on call while they eat.
Yes.
I seen them
And
leave.
many a time you get up before you're able to finish your meal. Yes, sir.
Mr. Chairman,
Yes.
executive meeting last night, we discussed those 3 board members, and all, those 3 are all, and we're in discussion with that. I just want to let y'all know.
Okay, so that's been presented, but not, you're just,
Right.
okay.
Because we just waiting to hear from y'all and.
Who your representatives will be, how to
Oh,
make
so
up.
you're agreeing to 3 and 3.
you agree with 3 and 3, we just have to
Okay.
find a committee office more.
Yes.
Okay, all right.
So y'all agreed to 3, depending upon who they are, whether y'all pick them
But it
individually.
shouldn't depend on who they are. It's 3 and 3.
Because it'll change.
Yeah,
Yeah, it'll change.
But I think that y'all wanted to start pretty quick, that's what I'm hearing.
Oh, yeah.
Why are you saying 3 and 3?
3 from
Three.
them.
3
3
from
from the
us,
squad.
3 from y'all, which one would include Buddy and then 2
The
representatives.
previous meeting, they grew the board to 10, so it was 7 to 3.
Right.
I didn't talk to the first citizens, who thought that was okay
Okay.
with the amount of money that was going. So then Mr. Bowman had been in negotiations with Mr. Williams to make the board more even. It was 3 squad, 3 from the county, one of which is Mr. Hyde, the other 2 be a supervisor.
And to me,
Other one will
that,
be a supervisor, right?
that seems reasonable.
We was
Two,
gonna do one,
three and three.
I thought we was gonna do only one supervisor and one public citizen.
Did you guys talk about that?
We did
Yeah,
not.
you said
When
we did.
it had been told to me it was gonna be 2
No,
supervisors.
No, I remember, I got a good memory. I ain't got no.
But
That was
this is second
discussed.
negotiation,
Yeah.
so.
Yeah.
Oh,
that's-
this was after the initial?
Yeah.
Okay.
I'm trying to meet them halfway.
I mean, we
So-
can talk about that
Yeah.
if that's what y'all want to do. I mean,
And we understand, like, the makeup currently of our board, EB sits as the chairman of the board and is not even a voting member. And this, the way we're presenting now, 3 and 3, he would then become a voting member. All 6 members of that board would be voting members. And that way, so if it's something you agree with, but we don't, and you deadlock, somebody got to give
So
up the
who's gonna
ghost.
take up the goat?
Well,
For whether it's
let's
truly
be- let's be
needed or
honest,
not
let's be
needed.
honest,
If we can't,
let's be honest, who got the money?
Well, that's why I
Okay,
said we
let's
didn't
be
need
honest.
3 and 3.
Point.
I don't think so.
Y'all said it ain't equal, we can't vote. I said we got checkbook off.
Exactly. So,
yeah,
and that's the
citizen,
reason we argued that point.
citizen-
but- yeah.
if we do the citizen member, that's because of the volume of phone calls and emails and messages and letters that we've gotten from citizens.
Exactly.
So,
And y'all talking
I can
full
think of a good one.
transparency, and I'm not saying this to hurt the feelings. I've talked to 66 people, and none of them want us, they have told me to give y'all the money. They don't want us to give you the money.
I'll talk to a bunch too that don't.
Well, but what we're hoping is we're not giving them the money. We are joining a partnership and we are
Just
being
staff.
part of the money.
That's why I'm
That's why-
emphasizing on staffing.
That's why, and I think this, we're gonna talk about this budget in a few minutes. I wouldn't get a citizen involved until this ship starts getting turned around. You with me? Because it really could get fogged up.
so we'll
But
get two supervisors.
if the citizen is a good numbers person and has EMS experience, why would you want to put somebody that does not have EMS experience, that's a board member of Nottoway County, on that board? That they got no insight, like he's,
I
I
agree
tell you
with
what,
that.
we could, I could tell you, yeah,
I
that's
agree with
fine.
that.
Right. And I hope you can find that person.
I don't found it. I just ain't announced him yet.
But you gotta be.
I bet we might be
careful
thinking of the
How
same
you
one.
just pick somebody, because you're not getting a full cross.
Well, we need to interview the person as a board.
So you won't put this on new business for the board meeting next week?
Sure.
Okay.
NCES, citizen member.
Let's see, okay.
I think y'all gonna love him.
So we know it's a him now, so.
All right. But that- I think we've, the horse is dead. We beat the horse. So
Beat it to death.
let's move on, Mr. Bowen. Thank you, guys.
No, Thank you.
Thank y'all.
Thank you.
Again, anything else you need, we're an open book.
Sir, you get a 10. That's 3 longer than 7. Oh. I lost my bet. Now you want me to pay you.
Oh, he meant the stockyard, not your house.
Is that what he meant?
Mr.
Thank you, sir.
Yeah.
Thank you.
So, Mr. Chairman, this is the budget that was proposed, that we're proposing. This came from many conversations with you. This is also a lot of meetings that we've had with the financial, the finance team, as Ms. Norton is the Madam Chair of that.
Not really, because I hadn't seen this until today.
Oh, so I thought you went to some of the meetings in.
I did, but
Okay,
I didn't.
that's what I'm talking
I
about.
didn't see this final copy till then.
All right, well, but this is what we talked about in the meetings. Okay. All right, so I'll leave that to Logan, so everybody get started.
All right, so the first page, we have an overview about what happened last year and kind of what we're looking forward to this year. So for FY '26, budget is balanced with expenses and revenues totaling $59,286,424 compared to the FY '25 budget of $52,174,165. That's an increase of $7,112,259. Right, the majority of this large increase can be attributed to federal grant funds for Nottoway County Public Schools that increased by $6,839,448 for FY '26. The FY '26 budget is balanced using $895,672 of fund balance transfers compared to the FY '25 budget that used $1.5 million of fund balance transfer. The fund balance used is broken down as follows. So this is what we're looking forward to FY '26. The transfer to general fund budget is $410,647. The transfer to landfill fund is $429,576. And this is an increase because in FY '25, it was $341,000 even, but the increase now is because we are moving communications tax revenue from landfill revenue to E911 revenue. And also the last transfer is for fire and EMS fund for $55,449.
So the two key numbers there that I want you to pay attention is, we're still going to the general fund, $895,000, and we're still, even with the tax hike that we're going to discuss, you're still going to transfer from the general fund $55,449 to to meet the obligations of your fire and EMS. Okay.
Then we
Next.
leads us to the creation of the fire and EMS fund. The creation of separate fire and EMS tax is projected to produce $1,473,500 of additional revenue to Nottoway County, broken down as follows. For fire and EMS real estate tax is at 7 cents per hundred, which would equal about $875,000. The fire and EMS personal property tax is at 63 cents per hundred, which would be $598,500.
So where you get those numbers at, a penny of real estate is $125,000. A penny for personal property is $9,500. Okay.
Next is the creation of fire and EMS fund continuation. So we have existing in FY '25 fire and EMS general fund obligations to be transferred to fire and EMS fund. We are moving the contributions to Blackstone Fire Department, $113,450. We are moving the Blackstone Volunteer Fire Department fire programs and 4 for Life pass-through money, which is $16,400. We're moving the contribution to Crew Volunteer Fire Department for $113,400. We're also moving the Crew Fire Department Fire programs and four for life pass-through money, which is $16,400. The contributions to Burkeville Volunteer Fire Department, which is $113,450. Yes, thank you.
Take your time.
Burkeville Volunteer Fire Department, fire programs, which is pass-through money, which is the $15,000. The contribution to Nottoway County Emergency Squad, which is the $210,000. The Nottoway County Emergency Squad, four for life pass-through money, which is $5,600. The contribution to Burkeville Rescue, which is $95,050. The Burkeville Volunteer Rescue Squad pass-through money for four for life is $5,600. And the Nottoway County Emergency Services County Department budget of $213,935. Overall, that is $918,335 for that whole page.
So that, what's the takeaway on this one? And you heard from some of our leadership, and we get into that deep in it. So I know people are concerned about it. You'll see in a few minutes, the radio project has been taken out of the fire and EMS tax levy. So we're getting to that now, but Buddy Hyde's entire budget, $213,935, which he has asked for more money this year because of IT and other things, that will be part of the tax levy. Okay? All right.
We continue on with new FY26 expenses included in fire and EMS fund. We're looking at the new Town of Blackstone Fire Training Facility funding for $10,000. Additional contributions for Nottoway County Emergency Squad is $500,000. Additional contribution for Burkeville Volunteer Rescue Squad is $200,000. Then we moved the debt service and implementation costs for the new radio system has been moved back to the general fund budget, which the radio debt service payments is going to be $515,000 for the first year. And the radio implementation is $180,000.
So total $695. So talk about that a little bit before we move. It was asked for $20,000 for the fire training facility. We just figured, right, we're trying to give towards it. I know a lot of people in other counties trained there, but we decided to go with $10,000. Nottoway County Emergency Squad did ask more of that. Of course, they're gonna still get the 180. I don't have it in front of me. We just talked about all this is additional money. That's not what they asked for, but we're trying to get them there. The additional contribution for Burkeville Volunteer Fire Department Rescue Squad, excuse me. I met with Brian Welsh and their leadership. The emergency squad went back in ARPA money. I think it was CARES money. Got a squad. The Blackstone Fire Department got $200,000 for a ladder truck. The crew fire department got a pumper, $200,000, and that was all ARPA money. And Burkeville did not ask for anything, but they said they will be coming back. But they did get a squad, we understand. And they would like the $200,000. So, and he's asked for $95,000 to meet payroll, the same thing that the Nottoway Emergency Squad is looking at, but his is $95,000. So what we're looking at for the next 3 years, so that $95,000 be payroll, that's forever and ever, amen. Okay, that's not a one-time money. He's the $200,000 that they need for the emergency squad. They're letting us make payments that they have agreed. Let's don't let us agree. Let's let us pay for the next 3 years, $65,000. So what you got there is $95,000 for $195 for big payroll. 135 to be payroll and 65,000 for equipment, right?
Yeah.
Okay.
You're saying 95.
I'm sorry, 135. Thank you, sir. And the debt service at the bottom, you'll see that on this sheet. The debt services that we're going into with the radio is $695,000, and it's over that in the actually what we're advertising, because we still have debt service for the school system. And that's 200 some thousand. I don't have that number with me right up, but it's 200 some thousand. Okay. All right.
Moving on to the breakdown of the fire and EMS tax. When looking at the fire and EMS budgets, EMS is 72% of the total versus 28% for fire. Two separate ordinances are needed, one for fire and one for EMS. based on the 72% or 28% breakdown, associated proposed tax rates would be. So we had real estate for fire at 2 pennies per 100. We also have personal property for fire at 18 cents per 100. We have real estate for EMS at 5 cents per 100, and we have personal property for EMS at 45 cents per 100.
Right?
Which is,
So basically, when you flip it, we're still going up to 10 cents. You say what you want to, but now the 48, now when you go to the next one, this is on the county side. This is the radio project. 3 cents went from 45 to 48. For real estate and personal property from $3.75 to $4.12 for the radio, to pay the debt service of $695,000 a year. I mean, a year. If they got questions.
anybody got any questions? You got real estate at 2 per 100, right? For the fire.
And that's the,
Right.
And then you drop down to real estate for the EMS is 5. 5, right?
Yes.
2 and 5 is,
7.
okay.
You're on 48 cents
So if you,
and 7 cents. It's gonna be two different line items.
so it's not gonna be, so the new proposed rate, it says real estate is 48,
Right.
So
What
total
is
is
it currently?
still 10.
45.
but we just said 7.
that's two different, you got 3 different taxes.
No.
Three different taxes.
You got your general fund, 48,
Right.
So it's
Then
still
you got-
gonna be 10 cents.
2 cents on fire, 5 cents on EMS. So the tax bill shows us to the citizens. what
It's gonna show them the breakdown, I understand, but it's changing the tax rate up by,
It's,
10 cents.
so last week we were 10 cents and $1 on fire.
Right.
That was not agreeable, so we moved it back. When we voted for the radio system, you and I were voting out of, we didn't know. that the
we
budget,
knew the need of it.
we knew the need of it,
Yeah,
but we didn't know that the budget didn't already,
exactly.
that there'd been no planning for that. So this is where we are.
So it'll be a totally different line item for each. That's
Yes.
okay, okay.
Okay?
All right.
We can go back after this is over, we'll talk some more.
All right, Mr. Bowen just read the next slide.
Oh, no, I'm sorry.
All right, I'll go over it again. So the proposed regular tax rates for real estate with the general fund is 48 cents per 100. And the current 2024 rate is 45 cents per 100. The personal property is going to 4.12 out of 100, and the current 2024 rate is 3.75 per 100.
This, and you can read this one, Heidi, so this is the largest increase of expense outside your fire and EMS actions. You got, $572,000. That is comp board positions that the committee said that we have to, we gotta pay. I want to make sure we clarify that, because some people are not gonna get, a 3% like they think so. Oh, wait a minute, let me do that. I didn't hear this, so I'm sorry. Now I want you to hear this, because I bet people are gonna raise Cain with you.
All right. Thank you for trying to say.
People are gonna raise Cain with you, and Ms. Norton knows about it. The comp board position, okay, let's say I'm making $60,000, okay? The board, the state says you gotta give them a 3% salary increase, okay? But I'm making 60,000. 50,000 is from the state, 10,000 is from the county, because I done moved up and county and gave me some increases. The 3% they gonna get on the 50,000, not the 60,000. Okay, all right, because people are gonna say, wait a minute, you done your math wrong. No, we haven't done our math wrong. Anyway, so they're not getting, they
It's
only get,
only on the state portion.
Okay.
not the county.
right. So I just wanna make sure y'all
Thank you
understood
for
that.
clarifying.
And then the 572 also is a new position, dispatch. And we just got word yesterday, a day before yesterday, there's 2 more new positions that state is making us, that's not making us, but giving them, that has to be filled. One for the Commonwealth Attorney and one for the Circuit Court Clerk. So that's gonna be another increase coming in, of your budget. Anyway.
I bring crime pays. Anyway, so,
Should have told me that.
all right,
All right, other FY 26 budget item expenses, we have decreased forecast costs for legal services from 150,000 to 135,000.
thank you, Catherine.
You're a bargain.
We will take
We have increased costs to Piedmont Regional Jail by 32,000, which is currently at 1,968,000. It's going up to 2 million even. There's increased contribution to Crossroads Community Services Board by $33,811 to $75,811. That's what we agreed to this year. Decreased debt service costs by $84,000, which came from the schools. Piedmont Area Veterans Council, we are giving them $2,500 contribution. We are also giving a $2,500 contribution to Piedmont Habitat for Humanity. They were not given contributions last year. They will be this year. Increased local funding to Nottoway County Public Schools and $1 million Nottoway Technical Center by $91,485. Other budget items for revenue is increased machinery and tools taxes by $30,000, increased local sales taxes by $25,000, increased business license fees by $30,000, increased revenue from interest by $100,000, and increased BCBR state reimbursement by $100,000.
There will be a touch more in the real estate book because of those,
Ones that's not on the book.
everything that was last year didn't get on the book.
Yeah, so that's, I'm hoping that's gonna make a difference.
And there's a potential to be more later for BCBR reimbursement.
Right, that's right.
All right, FY 26 landfill fund budget based on FY 25 year-to-date expense reports and FY 24 audits. We decreased landfill budget from $1,291,471 to $1,202,575, which is a difference of $88,896. FY 25 general fund transfer to support landfill fund is $341,471, and the
No, in 2025, yes, right.
FY 26 general fund transfer to support landfill fund is $429,576. Primary reason for the increase is fund balance contribution is because Board of Supervisors voted to remove the communications tax revenue of $151,000 from landfill fund revenue and place it in the E911 revenue. And that is supposed to take effect as of July 1. All right. FY 26 LRA fund budget based on FY 25 year-to-date expense report and FY 24 audit decreased LRA budget from $870,941 to $743,000 even. That's a difference of $127,941. FY 25 LRA reserve fund transfers to support budget is $193,650. And FY 26 LRA reserve fund transfers to support budget is $88,000. The decrease is $105,650. We have our next steps ready, but if y'all have any questions.
So I want to say this because I know I'm surrounded with people listening to my terms. Okay. So you voted for the radio project. The reason why you voted for the radio project because people came out and said, "Hey,
We saw the need.
we see the need. We have concerns. of People be in the house. They can't hear when they need help. That was important. Okay, that was really the first thing that happened when you started on the board. The second thing now you hear about the dispatchers. Okay, so I think some of y'all said, "Well, you gotta do something, Steve, before it dies." Okay, somebody dies, so you're putting $80,000 in for a manager to manage that. I'll bring some kind of professionalism in to help turn that around. Okay, that's $80,000. You go back to the new money where you got what you're doing for the Burkeville Fire Department, and Burkeville Rescue Squad, and the Nottoway Emergency Squad. You put all those numbers together. New money. You're doing about $1.4 million in new money for public safety. people can say what you can call it, whatever you want to call it, it's all public safety, okay? So if some of your citizens are saying, hey, I don't think, well, you're the ones that's been concerned about public safety. So that is what it is, okay? And that's it. And I hear a lot of compliments that finally this board is listening to what has been done years ago. And of course, I was on the board then too, and I understand it, but these are real numbers. And hopefully we can at least advertise and maybe let the public come to the public hearing and speak on it.
You want to make a motion? to
Or you got any
advertise
questions or
tax rate? Any
clarification?
questions? Everybody? Are you clear on what was going on, Bo, with moving,
Yes,
moving back to the radio?
We're certainly not making no vote on the budget.
Nope.
We're just making a motion.
Advertise.
for public
This
hearing.
is to advertise and the ability, after it's advertised, we discuss it and it could change lower.
Could change
We
lower, but I'm
have to meet our timelines, we have to advertise a budget.
And last year when they told us that it could be lower, it won't.
Two motions.
yes, too, but we need a motion to advertise tax rate and we need a motion to advertise the budget. It's two different things. It has to be in there.
We want to make a
Question?
Sure.
The decal funds, where's that going?
Oh,
DCF funds?
up to you, you got, that's
So
not,
that's not included in our 113 that,
no, that is part of your 113. Yeah, you get 63,000 something and the decal 50,000.
okay, so is that calculated in that tax rate?
No, sir. No, wait a minute.
Are they getting double taxed?
No. Wait a minute.
I see what you're saying. He's asking, was it taken out of that tax rate increase?
So it is. So that might be something that you rectify. In other words, we need to take out, that should say 60 something. What is it, 68?
It's 68, 450.
Well, I'll get to see if I,
63, 450.
I'll see if I get that rectified.
Okay.
Okay.
We'll confirm that.
And I appreciate your comment about giving more money to public
Public
safety.
safety, I know that word is tricky.
But also look, you're paying $2 million for Piedmont Regional Jail.
Amen. Yeah,
So,
no, that makes sense.
you
All
know,
right,
we're
all
paying
right.
more money for prisoners than
Right.
we are for public.
But
safety.
the point I'm trying to make with the board, they are listening.
Oh, yeah, no,
Yeah,
I agree.
yeah, that was really
I
the point.
appreciate that.
Yeah, chief, if the right ones are in Piedmont, that's a part of public safety.
Yeah.
So what I need to do is break away that decal money separate from the tax levy.
Because he's correct. If it's in the levy, then they pay.
Right, and anyway, okay,
Unless you keep them separate. And
Gotcha.
We continue with our.
yeah.
It's just one side.
But the thing about it too, let me say this. The decals is never 50,000. We give 50,000,
It's actually 38.
38 or
42.
40, but I round up. So that rounded up part might come back your tax levy.
Okay.
You with me? Okay.
All right, so I'm asking for a motion to advertise the tax rate.
I'll make the motion to advertise the tax rate for a public hearing.
Second.
All in favor? Aye. Any opposed? I need a motion to advertise the budget. Fiscal year 26, Nottoway County.
Mighty weak vote.
I'll make the motion to.
We looked at it yet. You don't do the numbers.
What do you?
So we
want to-
just gonna make the advertisement to look at it. Yeah, we ain't looking at nothing, I mean.
We're not gonna, I mean, we can advertise, we can
Yeah,
motion to
okay.
advertise and then take a look at it.
So the board, you guys got to ask, so what we talking about advertising, what, 2 weeks? Excuse me.
1 week.
I mean, but I mean, when we gonna have the public hearing? May 22nd, which is 2 weeks. So you got 2 weeks to ask me all the questions. Come on up and let's do all the numbers you want. Anyway,
Ms. Noyes, you make that motion?
I make the motion. And I encourage the public to look at the line items, not just the total.
I
Look at the line. items.
I'll second the motion.
All in favor, say aye. Any opposed? Okay, we'll advertise tax rate, advertise budget. Fiscal year 26 budget and tax rate public hearing, Thursday, May 22nd at 7 PM in the courtroom, General District.
right.
You want to do any more discussing on these numbers or?
No, the last item is the courthouse relocation public hearing.
You have a question mark there.
I got a question. All right, so
So what do we had? We just had like a public discussion. We tacked it on to something before and we had 3 people speak, I
right,
think.
nobody has ever said, do you want to do a referendum to move the courthouse to Crew? So if we are, we need to ask the elder firm to put that in a request to the judges, but we're gonna do that. I mean, so you can't say you're gonna move the courthouse. I'm asking, do you want to do a referendum to move the courthouse to Crew?
I have no desire to do a referendum. I went to Appomattox and saw how that turned out. I ended up in a fight with the judge.
I agree with Chairman.
And although I represent Crew and I know their intent, I've looked at what the committee is coming back with. It is just not financially feasible. It's gonna cost more money. You can't just, I think a lot of misconception is you just move the court. You have to move everything
To make it work
associated
right.
with it.
To
And
make it
when
work,
you
it's
do that, it would cost just exponentially more.
Plus, since Nottoway was here, this has been the county seat. Unless it was a
And
huge
that
savings
counts-
to the citizens.
And that counts for
Yeah, unless it's a
It's just-
savings to the citizens, why would you want to do it?
Okay, all right, but that's what I need.
Unless you were Crew, and if I were Crew, yeah, I'd like to see some revenue come up there, but it's still being here for.
But there's other things that we can help Crew with to generate revenue. That's a nice piece of ground. We've got our economic development folks. We had a meeting the other day with some folks from the state. So there's better things that can generate tax and be on the tax roll. A courthouse is not gonna go on their tax roll.
I agree. We do. One citizen told me, he said, Steve, come on. You did a referendum to move the statue and it got defeated almost 80-20. If Nottoway County don't want that statue moved, why in the world would you think they want to move the courthouse? That's a good point.
I've not had anybody else ask except for the folks that spoke at that meeting.
Okay. All right, well, there's no use making new business. We don't need new business. Okay, all right.
We've got comments from members of the board. Vice Chair Norton.
Exponentially hard last couple of months. But safety, health safety is priority. And the laws of Virginia require this board to take care of that. It doesn't say you have to have the money to do it. We don't. But we're gonna have to find it. And we don't have a revenue stream from business and industry and economic development. So we've looked at it every which way we can. Everybody on that committee knows that. I'm very concerned because we've talked to the treasurer. We're gonna have to pull money out of reserves and things that we were using to invest. And with the courthouse coming down the road, that's gonna make it even more difficult. But if people would pay us what they owe us, like the state, we'd be in a better position. But I know this is gonna be hard. We're gonna get a lot of grief, but comes down, rubber meets the road. Do you want the squad to come or not? And this is the only way to do it.
Well, Mr. Chairman, too, I'd like to piggyback on him because we got to form that board pretty quick, because what I just heard tonight, that somebody would like to have money in this fiscal year, this budget. We didn't budget to give any more money. But
Which means it would have to come out of general fund.
I want you to, well, he can look to see if it's gonna be a reappropriation. It needs to be public. The citizens need to understand the money got moved.
I just want to make sure everybody understands. Because I think Mr. Ingram made it clear. He would like to, the normal is crew volunteer fire department, we give them the 50,000 for this. I'm picking on Joy, 50,000 for the sticker money, and then you would give the 60-some thousand all at one time.
After revenues come in.
Right, after revenues come in. But what I'm hearing is payments need to be made right now. Do you understand?
That was my understanding. If that's I think the board still has, we haven't made it, we can make some phone calls and decide amongst ourselves how, what we think this is going to end up being.
Okay. So,
We're out of time. Yeah, I mean, we're out of time. There's citizens need.
Okay, thank you.
Mr. Toth.
I don't have any closing comments. Mr. Chairman.
Nothing.
I appreciate the meeting. I appreciate the transparency. And that's all I got to say.
Okay.
You give me a 10.
As I said, I appreciate, just like Bo, I appreciate the discussions I've learned and talked, and probably people see my phone number in y'all's phones and say, oh, here he is. But I had to do that so that I could educate myself and try to make good decisions. So I appreciate everybody taking my phone calls. And that's all I've got.
Question for you, the 5,000 for the tower budget for the maintenance, I didn't see that in there. The county gets 5,000 toward the tower maintenance a year.
But yeah, and so that didn't start yet. This next fiscal year, that wouldn't start until later on to the project's finished, I'm pretty sure.
So we just got the last one in February.
What are you talking about?
Tower.
Oh, I'm sorry. I knew,
Tower 6, not the.
No, I'm
not
sorry.
that.
Ladder truck maintenance was 5,000 a year.
68. Just an annual fee.
and that's not included.
Got that? He's asking if it is.
Well, Nan, if we will take 40,000 out for 3 fire departments, I got a little leeway. You with me? So I can get that back in. Okay. I think somebody from the town said they really don't need that. I mean, honestly.
Well, I get it. We keep track of it, so like all our POs and stuff come out from the town, so we keep track of it all. And, if y'all ask.
Okay, I got you. Okay. All right, so we'll make, I'll take, and just so you know, so what we'll have to do, Logan, we'll have to estimate the sticker money. I mean, basically what we're gonna do. But I still think we'll leave the rate where we're at, and then we'll have funds to cover that too as well, you know. Okay. All right, we'll get on. Good catch, thank you. All right, but is everybody happy that the radio project came out?
Yes.
Yeah, okay.
I heard some of my unhappiness today about the radio tower from a former head of the department, man.
Okay.
He didn't like it. I said, well, all you guys do, you can. But I said I won't see them on, so I'm ready to get
Right. You don't, and that's gonna be on business too. You might have to hear from a citizen didn't know about it, but we do.
They were probably not.
All
All right, well, that's all I've got to say. I need a motion to adjourn.
I'll make that motion.
All in favor? Aye.
Thank you.
Okay.
Is that all?
If our other 2 board members is not included when we do vote for the budget, I may not vote on it anyway, but I definitely vote.
They're not in the room.
And I just get 2 board members, but any of 2 of them. Yeah.